BT's Body and Balance is sponsored by Canada Diagnostic Centres, offering MRI, X-ray, and ultrasound services in Calgary and Okotoks.
Hemophilia is a rare genetic blood disorder where those with the disease do not clot properly. For Hemophilia Awareness Month, Health Specialist Leah Sarich is here now with how physiotherapists play a critical role in keeping these patients active and healthy.
Isn't that interesting?
Yeah.
I thought that was so interesting. So there are several different kinds of hemophilia. Type A affects about 1 in 10,000 people. Type B affects about 1 in 35,000 people. This is something I didn't know about hemophilia. Females are only carriers of the disease.
Oh, no kidding.
Yes, true story. So
Okay.
males get it. Sometimes, in very rare cases, females do get it, but that's very rare. But in about 30% of cases, they can be a spontaneous presentation of the disease.
Oh,
So they
really?
just don't know what's going on there. So it's not, in fact, genetic in all cases. There's also no cure for it. So basically, those who have it, they do not produce enough blood clotting proteins, or factors, as they call them. And so for children with it, you can just imagine a small bump, you know, they just wipe out all the time. This is what kids do. So the small bumps and scrapes, not a huge deal, but what if they took a tumble from their bike or the monkey bars? That can be a serious problem, and that's where the physiotherapists come in.
The ones that we really worry about are muscle bleeds or joint bleeds or internal bleeds like in the stomach or the head. These types of things often happen from some sort of minor trauma. If they fall off their bike, for example, and hit their knee, they might get a bleed into their knee joint. Or if they get hit by, you know, something into their muscle, then they might get a bleed into their muscle. And those ones are a little bit more serious because we have to try and get the blood out of there so that it doesn't cause damage.
Wow. So what's exactly going on is that blood is incredibly toxic to cartilage. So it destroys those joints very quickly. And of course, if you've got damage in those joints, then you're talking about disability in these kids, which can really limit them in numerous different ways. So this is Bryce. He's 12. He's in grade 7. He has hemophilia, and he was diagnosed right at birth because they actually knew of his family history. So they tested him right away. So he injured his knee, and so he's got a bit of a limp, as you can see here, and some mobility issues. And he's been working with Julia for about a month or so. And he says, really, apart from being injured right now, life with the disease is actually pretty normal.
It's mostly the same until you get injured badly, and then you have to get a bleed. You get a bleed, then you have to come here like back and forth, back and forth. If you don't get the treatment, it can damage your inside of your wherever you're bleeding, and really badly if you don't get all the blood out.
Yeah, so he's been working quite hard trying to get this knee back to normal. And that's, of course, where the physiotherapists come in. So the therapist will assess the injury in the joint. The patient will get that synthetic factor they need via an IV, so the blood will actually clot. Then the physiotherapist will stabilize that knee until the bleeding is done. But when you're stabilized, muscle wastes away very quickly. So once the bleed is sorted out, patients like Bryce, they have to work with a physiotherapist to get back that full range of motion. So that's what they're doing right now. They're doing all these exercises to make sure that knee gets back to normal, because of course Bryce is a kid and he wants to get back to normal. He wants to get his mobility back and get all his strength back as quickly as he can. That's what it's about.
Really interesting.
Yeah.
And more on your blog.
More on my blog a little later this morning.
BreakfastTelevision.ca is the way to find that. Health Specialist Leah Sarich, thank you very much.
You're very
for this.
welcome.